Good afternoon and welcome to the Wake County Board of Education work session for August 2nd, 2022. We have two items on our agenda. First, we are going to be hearing some health guidance updates. And with us is Paul Coe, Assistant Superintendent of Student Support Services, and I believe you have some other folks with you virtually.
Yes, we have Kelly Creech joining us virtually.
All right, so let's get started, and then we'll move on to updates on emergency remote instruction days. So two topics. Let's go.
All right. So good afternoon, Chair Mahaffey, Superintendent Moore, and board members. We're bringing to you an overview and updates related to COVID-19 health guidance today. And as I said, Kelly Creech has joined us virtually in case she can help us answer any questions. And I think I'm jumping ahead of the slides for a second. But for today's presentation, we wanted to review our context with COVID-19 in Wake County and review key points related to the sunset of the NC-DHHS Strong Schools NC Public Health Toolkit. And we want to provide an overview of updated guidance aligned to the CDC. And so first, with our context in our county, and though there have been updates to this data, I wanted to share that as of July 26, 2022, Wake County is currently at a medium COVID-19 community level. And on July 26, we had 50 counties in North Carolina with high risk of illness or strain on the healthcare system. And as of August 1st, we are at 60 counties in North Carolina. And as it relates to some familiar health metrics from the NCDHHS dashboard, we have that Wake County's population with at least one dose is at 77%, and Wake County's population vaccinated with initial series complete is at 74%. And our students aged 5 to 11 with at least one dose is at 48%, and the same age group with vaccinated with initial series complete is at 46%. And our students aged 12 to 17 with one dose are at 69%, and the same age group vaccinated with initial series complete is at 67%. And for our cases per 100,000, on July 26, we were at 277 cases per 100,000, but as of August 1st, we are now at 302 cases per 100,000. And our percent positivity on July 21st as a county was at 19.2%, and as of July 28th, we're at 19.5%. And this slide is familiar to you, but I just wanted to make sure we review, since we're starting a new school year, about the CDC community levels and how they're determined. And so when any county is at the low level, the cases per 100,000 is less than 200 cases. Plus, there are less than 10 new COVID-19 hospital admissions per 100,000 over a 7-day total. Plus, there are less than 10% of staffed inpatient beds occupied by COVID-19 patients over a 7-day average. I know that's a lot. Follow along. And for the medium, there are two avenues to be at a medium level. The first avenue is that for our cases per 100,000, there are less than 200 cases. Plus, we are between 10 and 19.9 new COVID-19 hospital admissions per 100,000 over a 7-day total, plus being between 10 and 14.9% of staffed inpatient beds occupied by COVID-19 patients over a 7-day average. The second avenue to medium is that our cases per 100,000 are at 200 cases or more. Plus, we have less than 10 new COVID-19 hospital admissions per 100,000 over a 7-day total, and less than 10% of staffed inpatient beds occupied by COVID-19 patients over a 7-day average. And for the high level, for cases per 100,000, if a county is at 200 cases or more, plus 10 or more new COVID-19 hospital admissions per 100,000 over a 7-day total, and 10% or higher staffed inpatient beds occupied by COVID-19 patients over a 7-day average. And so, as you all are aware, the Strong Schools NC Public Health Toolkit sunset on June 23rd, and schools are now directed to the CDC's operational guidance for K-12 schools and early care and education programs. And some of the key highlights from the sunset include There's no longer a recommendation that schools require staff to report their vaccination status and participate in a screening program if they are unvaccinated. It's no longer recommended that schools implement physical distancing strategies. It's no longer recommended to do universal contact tracing, and masks are recommended in communities with high COVID-19 levels, and testing, ventilation, and cleaning remain important layers of protection. And following the sunset of the toolkit, we felt it was important to highlight the continued mitigation strategies recommended by CDC and review the key mitigation practices we are focusing on as a school district at this time. And it first starts with the CDC recommendation noting that we should stay up to date with COVID-19 vaccinations to prevent severe disease. And CDC recommends that COVID-19 primary series vaccines for everyone ages 6 months and older, and COVID-19 boosters for everyone ages 5 years and older, if eligible. And in addition, we are emphasizing the importance of hand hygiene and respiratory etiquette, and that's a new term, but it reiterates the importance of covering your mouth and nose with a tissue when you cough or sneeze. And if you don't have a tissue, cough or sneeze into your elbow, not your hands. And now when it comes to staying home when not feeling well, there was a slight adjustment to the language we needed to point out compared to what is in Assembly. It should read, whenever an individual is sick, not feeling well, or has symptoms of COVID-19, they should stay home and get tested for COVID-19 per CDC recommendations. And that those at risk of severe illness with COVID-19 who test positive should consult with a healthcare provider immediately for possible treatment, even if symptoms are mild. And for our when to return guidance, we have our guidance posted on our wcpss.net/when to return website that outlines the steps to return for COVID-19 positive individuals and those with symptoms. And for masks, there are no current local, state, or federal policies mandating universal masking in schools. We remain in contact with local public health officials about CDC community levels of COVID-19 and as it pertains to masking and our mitigation strategies. And staff and students are recommended to wear a mask in the following scenarios: at least 10 days after symptoms onset or testing positive for COVID-19, 5 days for quarantining, and 5 days upon returning, and at least 10 days following an exposure to a person with COVID-19. And individuals who are at increased risk for severe illness due to COVID-19 are unvaccinated or are not up to date on vaccines should wear a mask in indoor settings. And again, those are recommendations from the CDC. And for this slide, there was also an adjustment to the language we wanted to clarify compared to what's been uploaded in Assembly. It should read that for situations in which students are recommended to wear masks, not required, if a student cannot wear a mask due to a medical condition or disabilities, families may request a mask accommodation by submitting a mask accommodation request form to the principal. And families for our students in regional programs do not need to complete this form. And also, just to note, in the rare instance where a student would be required to mask, some examples might be, an internship at a hospital or a field trip destination where masks might be required. We wanted to ensure our families knew the process for requesting a mask accommodation. And then for COVID-19 reporting, we are required by North Carolina general statute to report, and our principals and supervisors will be reporting COVID-19 cases on a daily basis. And as has been our practice, our COVID-19 dashboard will be updated each Monday with the previous week's cases. And as you may have heard, for COVID-19 testing, we have discontinued pooled testing. Instead, all school sites and central services departments are being provided at-home test kits to provide to families and staff upon request for symptoms of COVID-19. And there are some guidelines we need to follow as it pertains to at-home testing. And this is per state guidelines. Our parents, guardians, and staff should follow testing directions with test kits. Test kits should not be given directly to students, and testing should not be performed on WCPSS school or work sites due to the state testing guidelines. And families and staff should continue to report positive cases to their principal or supervisor, and principals and central services can contact our purchasing department to order additional test kits as needed. And for our health rooms, there are some key points we wanted to share as well. Separate COVID-19 care centers are no longer required. And as before the pandemic, health rooms are the designated space to isolate symptomatic individuals who become ill during the school day or disclose that they have tested positive for COVID-19. And when individuals are sick or not feeling well, they should wear a mask while waiting in the health room to leave the school, and supervising staff members should wear masks while in the health room. And when it comes to ventilation and cleaning and disinfecting, they remain important layers of mitigation as per the CDC. And our continued practices are outlined. We are continuing to clean and disinfect using EPA-approved disinfectant for COVID-19, and surfaces, touch points, bathrooms, kitchens will all be cleaned and disinfected. Cafeteria staff will disinfect tables before and after meals. School staff will disinfect tables after class seatings. Soap and paper towel dispensers will be checked regularly and replenished, along with hand sanitizer dispensers as well. And we're continuing the use of our MERV 13 high filtration filters in our HVAC systems in our schools and buildings. And for our families requesting accommodations or extra precautions, we, as a district, we will make reasonable accommodations for students and staff with disabilities when required by the ADA, Section 504, and/or the IDEA. And any request for accommodations or modifications to the school environment for a medical condition should be handled through a 504 or an IEP team. And for students not designated with a 504 or IEP plan, a referral for evaluation can be made by families directly to the school. And if questions arise regarding whether a particular accommodation is reasonable or appropriate, schools should contact the Special Education Services Department or the District 504 team for assistance. And just to note, it's not on this slide, but we wanted to note that for our staff, they're able to make requests for accommodations through our ADA accommodation process. And just to summarize our presentation, we just wanted to make sure we outline all the mitigation strategies we have been implementing and continue to do so per CDC guidance. So just to refresh, we're going to continue monitoring COVID-19 community levels and continue to stay in touch with our local public health officials on best practice strategies and monitoring CDC guidance as necessary. And we're going to remind families and schools about staying up to date on vaccinations, the importance of hand hygiene and respiratory etiquette. We're continuing to remind staff and families to stay home when sick, not feeling well, or have symptoms of COVID-19. And we're recommending all staff, students, and visitors wear masks as a way to prevent the spread of COVID-19. We're continuing to ask all families and staff to report COVID-19 cases, and we will continue to share that information on our dashboard. And we're going to ensure that there are masks available at school should students and families want them. Like I said, we're providing at-home test kits to all schools and departments to ensure that parents and guardians and staff with COVID-19 symptoms can have access to the test kits upon request. And students who are sick, not feeling well, and those with COVID-19 symptoms or disclose a positive test will be isolated in school health rooms and will be provided a mask. And as I've said in previous slides, we're going to continue to disinfect and clean our surfaces, touch points, restrooms, classrooms, buses, kitchens, cafeteria tables regularly, and soap and paper towel dispensers checked regularly and replenished, along with hand sanitizers, and the use of MERV 13 high filtration filters in our HVAC systems will continue. So now I'll pause here for any questions or discussion.
Okay. Thank you, Mr. Coe. Ms. Waters.
Thank you, Mr. Coe, for that update. I just had a question for families who may have been out of the district or who have been virtual and who may be returning for the first time this school year and who are seeking an accommodation. What kind of timeline should they expect if they are preparing to come back? And can they go ahead and start that ADA accommodation process now, or do they need to wait until school is in session?
Thanks for that question, Ms. Waters. I think it'll depend on depending on whether school's in session or not. Those schools that are in session, because staff are in the building, we should be able to hopefully meet those requests in a timely fashion. But the ones who are not yet in session, it may take a little bit longer to be able to ensure that staff are available and not taking time off. But in terms of an exact timeline, I would say it depends on the team and the availability of the staff. But I think I can assure you that our staff are going to be working to address the needs in a timely manner, because we know that there's a group of families coming back to school in person maybe for the first time in a while.
Thank you.
Thank you. And I guess just following up, would a healthcare plan be something that a parent could talk to? I know it said 504 IEP, but would that be like a health plan with the school nurse?
I think if those are necessary, those can also be addressed at the school level so that the school nurse can be a part of discussions between the school family and the healthcare provider.
Okay. Ms. Scott?
Thank you, and that was part of my question as well, was who would they be reaching out to on slide 17? I think it was slide 17. It said, for students not designated with 504 IEP needs a referral for evaluation. What type of evaluation were you, is that referring to an IEP or 504?
Yeah,
Okay.
for any medical condition needs, and I think if they don't know where to go, starting with the principal would be the best place to begin the process.
Thank you. Thanks. And then I just have a few other questions really quick. Would we expect, and I do not want to put any extra burden on principals or teachers, but is there any sort of best practice when it comes to monitoring a school for perhaps what appears to be a pretty large number of students or staff out if there appears to be an outbreak? Like, is there a point where our health department would potentially recommend that we just give families a little extra in case they're not monitoring the dashboard on a daily basis, but just as a courtesy or as a way to say, hey, there's 8 kids out in your kids' class, so, be mindful of that.
So we are in touch with the local public health department weekly. Our health crisis and prevention services team, through Kelly Creech's team, meets with Wake County Public Health on a weekly basis. And I believe if there were concerns that they needed to address with us, they would share those with us. But we also have a process between schools and our area superintendents to be mindful of what might be going on, both at the staffing level or at the student level, to understand are school closures necessary or classroom closure necessary or not.
I appreciate that. I just think that there are some families who have medically fragile people at home, but they just want to have a way to be more aware, just be extra cautious if possible. I think I appreciate that you're monitoring that guidance from them, as they would be the ones to provide that information to us. Really grateful to hear the recommendation for masks in health room. I really hope that our families can understand that, where we have office staff who are exposed to that on a regular basis. So anytime we can do something to help protect them, I think our front office staff would appreciate that as well, or the people who are in charge of those rooms. And then the last question that I had was about, it's 2 parts. HEPA filters. A lot of schools purchase HEPA filters for individual classrooms, or teachers purchase them. Are we still allowing those in rooms?
I think that's something, whether we are allowing it or not, I'm not sure we have taken a stance per se, but I think in terms of the process each school has engaged in with how our PTAs or parent support might allow HEPA filters into the building is something that we can get back to you about how we're handling that as a system.
I think I can say if anything that is not district provided is not district maintained. So if it's provided through some other means, then maintenance and use are governed by the locus at where that happens.
Okay. Thank you. I do appreciate that. Sometimes, though, we're told that you cannot have things, but that's, as long as that understanding's there and that's allowed, I think that would also provide some comfort to folks in classrooms, especially those that don't have windows and so forth. And then the last thing, I think Ms. Cash asked this question about the the air conditioning units in some of our new buildings, where they were turning off when people weren't in the rooms, and there was concern a year ago about, is that stagnant air, or is that moving? And I just thought about this. I wondered if that had been resolved.
I don't know that I have an answer to that. Okay. Our chief operating officer believes that it has, but we'll follow up and make sure.
Okay, thank you.
We discussed that in facilities, yeah. I mean, those are disabled.
Yeah.
If they're not, then they should be.
Well, I don't
Right.
think we got a definite report on all of them being disabled. I know some were disabled, and
The discussion was that was
they were
going
all
to be,
disabled. That's amazing. Good.
that was the instruction. So if they're not, then we need to be notified so they can be.
Yep, we'll verify.
Thank you. Those are all my questions. Thank you.
Thank you.
All right. Dr. Martin?
Thank you. This is a difficult topic, and I respect your work. At the same time, I think we can and must do better. I think I'm going to start in sort of reverse order than where the presentation was. We can and must do better with people with special needs. I have talked to several people who have tried to get accommodations, and they're extremely frustrated. Going through the 504 process is simply inadequate. You don't do a 504 for peanut allergy or any other nut allergy. And in many respects, the safety considerations for something like COVID for many people are similar to that. And by the way, this is not the sky is falling scenario, but this is not, oh, everything's fine, just get over it scenario, right? We've got to find that middle ground, and that middle ground is particularly challenging for folks with special needs. Now, CDC had some pretty clear advice on that. And I don't see in anything that was described here recognizing the CDC language. It says, and I quote, schools with students at risk for getting very sick with COVID-19 must make reasonable modifications when necessary to ensure that all students, including those with disabilities, are able to access in-person learning. Schools might need to require masking based on federal, state, or local laws and policies to ensure that students with immunocompromising conditions or other conditions that increase their risk for getting very sick with COVID-19 can access in-person learning. For more information, access the Department of Education's Disability Rights, which says basically the same thing. It says students with immunocompromising conditions or other conditions or disabilities that increase risk for getting very sick with COVID should not be placed into separate classrooms or otherwise segregated from other students. Okay, that's the CDC language. And yet I know that parents have been told, well, just have your kid mask. That's not what this is saying. Yes, your kid can and should mask if they are at risk, but the whole statement that says schools might need to require masking, that's not for the individual compromised, that's for other people, to support that individual. I don't know when and where that's the case or needs to happen, but the point is, other people, the system is required to make accommodations for the disadvantaged student. The burden cannot and should not wholly be on the disadvantaged student. We have had students who were told, or families who were told, well, you can just do home medical for your child. No, that's not what this says. This says students should not be placed into separate classrooms or otherwise segregated from other students. So advice that has been going to individual families is in complete contrast to the CDC recommendations. We can and must do better. I think they're very clear on this, and this is going to mean that sometimes we're going to need to say, wear a mask for somebody else. Maybe that's to staff, maybe that's to a community. At a minimum, on slide 11, where we say when should masks be worn, right? We give a list of several things. I see no reason why we don't add to that list and say, and to support staff and students who may have special needs. Right? We can call upon each other to wear a mask because my wearing a mask may help you and your family. Let's put that right up front as part of our recommendations. So let's look out for the people with special needs, both in a community effort, right? This is not required at that level, but according to the Department of Education and CDC, it may be that we need to require some environments so that all students, including those with disabilities, have access to a free public education. I don't see that represented anywhere here. This is a requirement. This is an option. The option is we can encourage you to be helpful to your colleagues. That is option. That recommendation is option. But when I read the guidelines, there's some pretty strong requirements, and that's not being met. And like I say, I know that we have cases where people have said, well, you can just keep your kid home and do medical. No, that is contrary to what CDC is saying. We've got to do better on the special needs. A little bit to Ms. Scott's point about, what do you do if there are flare-ups in particular settings? Again, the CDC recommendations have specific guidance. Their specific guidance is that you really should take different action as a cohort if there are 3 or more, they talk about in a core group being like a sports team or a classroom or something like that, over the span of 14 days. So if there's an incidence, not 3 in a whole school, but if there's 3 in a core group over a period of 14 days, that's when CDC recommends taking another level of action. It's not like because the whole community may be at a medium level of transmission, everything it stays the same. CDC recognizes that there needs to be some core differentiation. So, and there are other school districts who do this, and I think we can and should pay attention to that. When you look at our schools, we have schools that have not had any significant issue, right? If you only have 1 or 2 cases per week, that's normal to what would be expected based on the community level that we see. But when you have these flare-ups of 5, 10, 15, 20, 25 people in a school, something else is going on, right? And these are often clustered in multiple weeks. I've provided, its data is available. I did the sort for you all and sent it to you this morning. There are places where this is happening. What CDC recommends is if it's 3 or more cases or 10% of the population of whatever that core is, that's when you should take a different kind of action, right? This is not across the board saying everybody must mandatory go to masks. But if you've got an outbreak as they define, then we probably ought to go to a stage where you take some different level of action. Maybe that's masking. Maybe that's cohorting. Maybe it could be a number of things. But the point is, all we've done is have this broad general guidance. And what I hear families asking for is not some imposition across the whole system. But when you've got situations happening, we don't need to wait for the public health department to tell us, oh, you might have something going on. The public health department is overwhelmed. They don't have enough staff. CDC has clear guidance. We know when there are 3 or more cases or 10% of the group. That's fairly easy. We could put something in place that says when we reach that threshold, we go ahead and take differential action. So I think we really do need to look at differentiating school by school. As we look at that differentiating school by school, we need to look at the data we have, evaluate those schools. Some schools have had no substantial issue that you could call an outbreak. Others have had several or pretty significant. Let's look school by school. Let's evaluate. Is it a facility issue? Is it a policy issue? Is it a leadership issue? Is it a community culture issue? What is it that's differentiating school by school? We may not be able to answer all the time, but we need to at least look at it and consider differential response where there are issues. And finally, when we look at numbers, it's frankly a little bit tiring when numbers and statements seem to underplay everything, right? We're in the yellow, so people are happy about that. Why are we in the yellow? Well, first of all, the case rates reported here are lower than what is reported on the state's website and on the county's website. It's not that hard to get the numbers. I don't know where the differentiation in numbers comes from, but we're actually at 315 right now, not 300, and it goes higher than that. But then we look at the number of hospital admissions. Apparently we're in the yellow. Well, we have 75 daily cases right now here in Wake County. So that's 75 cases. Translates to 6.7 per 100,000 population. The medium to high threshold, remember, was at 10. So so if you're less than 10, then it's you're in the medium. If it's greater than 10, then you're at high. Well, last I checked, 6.7 is closer to 10 than it is away from 10. So that means we're medium, bordering on high. If you look at the percentage of hospital beds, we're fortunate here in Wake County because we have a lot of hospital beds. So right now, those 75 COVID patients in hospital beds represent about 5.3% of our beds. So even though we have a lot of hospital beds, we're halfway on the medium scale. So part of the reason why so many counties in North Carolina are in red, they may have the same incidence of outbreak that we do, but they have fewer hospital beds. And if they have fewer hospital beds, that's going to shift them into the high category. We're fortunate, don't get me wrong, to have this number of hospital beds. But if we're talking about keeping a disease under control, we can't just rely on the fact that we're lucky that we have a lot of hospital beds. We as a population need to recognize that even under our luxurious conditions, we're on the high side of medium. So then that says, what should we do? CDC doesn't, to slide 6 that says what are no longer required. CDC does not
Dr. Martin,
say,
I'm sorry to interrupt, and I know I want you to finish your point, but we do have another item on the agenda.
I
And there are
understand.
other people with questions.
I
Thank you.
completely understand. Thank you. CDC does not just say we don't need, that masks are only recommended for high levels. That's not true. Universal masking is recommended for high levels, not just no masking. The implication here is if you're not at high level, from this statement on our slide, the implication is you only need to do masks if you're high. We're not high, don't need to worry about masks. CDC says universal masking should be implemented at high. We're not at high, so we don't need universal masking. We're getting close to high, therefore, we ought to strongly be recommending it. And it's sort of there, but by making this statement that masks are only needed for high does not communicate what's actually going on. You know, CDC does not no longer recommend that distancing is not required. I'm sorry, the statement here says, the highlights no longer recommend that schools implement physical distancing strategies. No, that's not true.
Dr.
They don't
Martin, do you
require
have a
it.
question for Mr. Coe?
My question is, why do all of these statements underrepresent what CDC is saying? Why do we not have the cohorting? Why are we not looking school by school specific? And why are we not following the guidance required for disabilities? I'm sorry, I know it needed to take a long time. This is important work. This needed more than a report. We as a board, I believe, have an obligation to do work, to put policies in place, practices in place that actually provide the protections, not only that make good sense, but that are also required.
Thank you, Dr. Martin.
So if I may, for time's sake, Dr. Martin, thank you for that feedback, and it's something that we will look into and partner with our local public health department as needed. But when it comes to the special education needs and or the 504 needs, the reason we were advised that way is that that's the best way in which we can ensure that we're meeting with the families at the individual level and go through the mechanisms and processes that we're required to do under ADA, Section 504, and IEP processes. And I
But
know
so many are beyond 504.
right, and so, but the mechanism we've been advised to encourage our families to use is to start there. But hopefully, there's a conversation that's happening between families and schools so that it's not just a cut and dry. Please wear a mask and best of luck to you. That's not what we're aspiring to do. So that's something that we can look at and see if we can get better at with our families.
Respectfully, you and I both know that that is what's happening, however.
So we're going to move on to other questions from board members. Ms. Kushner, you had your hand up?
Thank you. And I had a few questions, an easier one first, I hope. With meals, we've often heard that is one, I think the guidance that we are continuing is guidance we've had longstanding for communicable diseases.
Yes, ma'am.
I think that needs to be emphasized as part of our culture. I think to Dr. Martin's point that our schools are taking this seriously. I think the overwhelming lesson of the last few years is that students need to be in person in school. And so the word cohort kind of, that is a non-starter. I think we should absolutely not consider cohorts again. Students need to be in school. And I think our...
Saying out of cohort, please.
Pardon?
Dr. Martin, we're,
Cohort, I'm not talking about the cohorting.
Well, I'm just saying that was a trigger for me, so I just, non-starter, we're not doing cohorts in my, I would say we should not even talk about it anymore. So, but masks work. I think mask mandates have been shown to be ineffective because people don't follow them. And I do think that puts the burden on too many people who have autoimmune and other special needs. It's terribly unfair, but I think we as a school system need to emphasize masking is a tool. Our air quality efforts are an important tool, so I would hope that we're encouraging not just the MERV filters, and our air quality efforts must be communicated to parents, because I think that is an important tool for us to emphasize. And I think that we should, and I hope our educators and staff are encouraging masking when that is protective to students. I think Dr. Martin's point about special needs students is critically important, because students with special needs need to be in person too. All of our kids need to be in person as much as is possible. So one of my concerns that I think I wanted to ask, and I did give Mr. Koa a heads up about outdoor options for meals, because meals have been, at the beginning of the pandemic, became evident that that is one way that it does spread more readily. So what outdoor options do we have for meals and for instruction, and using those wonderful picnic tables that we distributed to schools?
Yes, ma'am. Thank you for your input and for that question. So as we've discussed before, our mitigation strategies, most of these are not new or updates per se. It's just the start of a new school year, so we're just trying to make sure that we're bringing the things that we have been doing. When it comes to eating meals outside, what we've sent out to our community and our schools is to, the weather is nice enough right now, especially, some days it's too hot maybe to be outside, but as available, we are encouraging our schools to ensure our students are eating and learning and playing outside as much as possible, because those are available to them. We don't want to underutilize the resources we set up to be able to eat outside over the last 3 school years.
Thank you. And I think our staff worked so hard in the last year, and we've learned the tools that are available, and I hope we can underscore both from the board level on down to the school level the culture of mitigating communicable disease of all sorts as much as we can. So thank you for this update.
thank you, Ms. Kushner. Ms. Cash, and I'm just going to remind folks, we have about 15 minutes left in our work session, and we do have another item. 5:30. Not 15 minutes, 45 minutes, and we do have another item.
I have one question. No, that would not be me. I have more than one question. Okay, on slide 11, if you are a student that has a mask accommodation, but you have gotten COVID, it says that you, at least 10 days after the symptoms onset or testing positive, you have to 5-day quarantine and then 5-day masking upon return. Now, a student that is a mask mandate, do they do 5 days quarantine but come back without a mask?
I think we'd have to talk through that scenario based on just making sure that the student and their condition, we're going to lean towards safety in that scenario, Ms. Cash. But if a student has a mask accommodation, or they're part of a regional program or classroom, or they're not
Okay.
able to put on a mask, we wouldn't just say
Okay.
this is like a blanket thing for
Okay.
everybody.
Pretty individualized.
Yes,
That makes
ma'am.
sense.
Yeah.
That's okay. That's good. And then students that are traveling out of the country, because I think I noted on maybe some of our schools, if they're traveling out of the country, I know there's certain requirements for people that go back to job after they've been out of the country or go back to working in hospitals. What is our requirement for students that have traveled out of the country before they can come back to school?
I think outside of the actual federal regulations for coming in and out of the country, besides those, I think, I forget, I need to look it up, Ms. Cashers, don't hold me to this, but if there is a federal requirement to, when you're coming from one country back into the U.S. and you need to test, for example, 72 hours before, outside of that requirement, as long as they're not sick, ill, or have symptoms of COVID-19, they would be able to return to school.
Okay. And then, this is on facilities, so I know Mr. Strickland is here. I think we need to go out and, because you have lots of time to do this, we need to go out and assess our outdoor eating and seating conditions in our schools, or at least get something from our principals. From what I've seen, I think we did a really good job, so thank you. But I think a lot of these outdoor tables and things have been stacked in areas and have broken down at some over the summer and don't feel like they're usable right now. And I want to hope that all of our schools have access to outdoor seating. So if maybe principals could give you a report on that, that would be helpful.
That's something we can do, I believe, Ms.
And
Cash.
that all playgrounds are open.
Yes, as you're
Thank
looking
you.
at Mr. Strickland.
And we're open for volunteers as well, for sure.
Yeah, another story.
Yeah. All right, Ms. Carter, and then Mr. Haggerty.
All right, thank you. And I guess I had a question, going back to what Ms. Scott was talking about with the health rooms. It says they should, so is that a requirement, I guess, for clarification for any folks listening in so they have a clear understanding?
With
If they
the
go to the health room, is it a requirement?
Yeah, we're going to provide the students masks, Ms. Carter, just out of
Okay.
safety, both
Okay.
staff and the individual. But I think if there are particular needs, like Ms. Cash was mentioning, like we would have to accommodate those needs. But we're trying to do a balancing act of
Right.
safety and just also what a student or an individual is able to do.
Okay, so I
Yeah.
just, for me, because I read should, and
Yep.
but if you say must, that's a different, you said, does that make
Yeah,
sense?
yes, ma'am.
So I think we need to be very clear with that
I-
expectation if it is a
Right.
requirement, just so folks aren't, especially when you're sick, it's not an ideal time to learn about a new requirement, so just so folks know if that's what we're saying. Yeah.
If I could, I think should is recommended. And here it's being sort of highly recommended, and a
Okay.
mask is being provided, and so on and so forth. But should is recommended, highly, must is a requirement.
that's
And
what I was
that
trying to-
overall here, where you've been, is that you had mandates, mask mandates, then you had, the board had their rules where they had to make monthly decisions. Ultimately, the board removed the mask mandate. So what is left right now, and it's been the board's call on masking requirements, staff's been implementing and handling operational details. Where is it left where it's required? I think, Paul's talked about, Ms. Coe's talked about some of that if you're going to somebody other site and they're imposing a mask requirement, then it's a requirement. If it's a field trip and the site itself requires it, that doesn't require board approval, obviously,
Yeah,
right?
right.
That's another site. Or if it is in an individualized situation through federal law that the district follows 504, the IEP process, and it results in a determination of masking. Again, that's not a board call. That would have to be based on an individualized determination that masking is required so that a student can have access to education. But other than that, right now, it's in the should, the recommended realm. And I just, for clarity purposes,
Right,
that's how
that's
this
what I was looking
document
for. Yeah.
is drafted.
Okay.
And then
Thank
beyond
you.
that, it's a board call.
Okay, yeah, that's what I was trying to clarify. And then I guess for more clarification, because, I've had folks, reach out and, if you go to the CDC, they have that, if we reach high, and then they have like the bullet points, not separate document than operational, which is what we're going by, so I think that has created some conflicting information for folks, because if you go to the high, setting the first bullet point is on that separate chart, it says wear a well-fitted mask. It doesn't say should on the CDC, which is separate from, again, that's not part of the operational document that we're, am I making sense here? But I'm trying to clarify because I know I've been contacted by folks that are seeing this and trying to understand why that verbiage or what have you is not being reflected in what we're sending out. Does that make sense? Because there are two separate documents. One says should or recommend, all masks, but then if you go to the, do you know what chart I'm talking about?
Yes, ma'am. You're talking about in the.
Because it's like people keep saying, well, if we reach high, then that means we're doing required mask
Right, maybe-
automatically. So that's
yeah.
where I'm just trying to clarify so those are two separate documents. So it doesn't mean if we, I'm not wishing anything, but if we did in the future reach high, that does not automatically mean a mask requirement. I'm trying to just clarify that because the documents on CDC that can lead to some confusion, because if you look, you're like, well, it's on the same site, but we're going by the operational for the K through 12.
Yeah,
Okay.
the CDC it's recommendations. And so if you've gotten the high, then the board would have to take that into account in deciding what masking you want to do as a board.
Thank you. Just trying to clarify.
All right. Mr. Haggerty?
Thank you. And, Mr. Coe, I just have 3 quick points that I'd like to make. And based on the work session today, I have some concerns when you said that the process for seeking accommodations would be through the 504 process. I understand the logic of that, but my concern is that right now we already have many families that experience a backlog going through the 504 process, and if you add in physical or health-based accommodations specifically around these issues, are you both delaying those people that are going through the 504 for other traditional like learning needs, and also then delaying those that are seeking them for health needs? And I don't know if Ms. Mahaffey's suggestion, Chair Mahaffey's suggestion about looking at a school health plan could be an option or alternative, but I do want to just express some concern or some caution about bottlenecks and how this could slow things down on both sides of that process.
Yes, sir, Mr. Haggerty. And I think we could look into it to see if there are ways to maybe not allow our families not to experience such a backlog, and if there are potentially other avenues. But this is the way that our attorneys were recommending us to make sure that we put the right mechanisms in place for our families so that the ability to create accommodations within the school environment fall under those federal guidelines.
And I believe it's an excellent process. I am just concerned about bandwidth.
Yes, sir.
Finally, the form of accommodations, I do want to also express that I'd like to make sure, I think there are reasonable accommodations, some things that have been suggested, things like outdoor meals, separate meals. You know, there should be a range of common sense accommodations beyond just home hospital.
Yes, sir.
And just making sure that those will be considered. And then finally, just the last point, you know, we talk about the protocols in place and differences between schools, but I think that underscores something really important, right? I mean, if we have the same or universal protocols, they might not be enforced exactly the same way, but it also suggests that there's other transmission outside of schools. And just because there's differences in transmissions rates in schools, it doesn't necessarily mean it's because of something going on in the schools. It can be the culture, it can be the community, different families, different individual choices that are made, as Wake County is a very diverse county. And we have people living in different places that follow different levels of the safety protocol. So I just want to make it clear that not all of these cases that we track are all generated because of something inside the school. And we can have these differences from school to school because of individual choice as well. That's all.
Yes, sir, Mr. Haggerty. And I think in terms of any concerns related to the school, the cases that we report are reviewed by the local public health department. If there are, concerns around potential clusters or spikes in cases in specific areas, those are things we will connect with our local public health department about. But to your point, we're living in the world that we are, and community and school are kind of intersecting at this. And so because there's no mandated contact tracing, it's difficult to pinpoint where the root causes are. But I think that's why we're just trying to really emphasize the importance of mitigation strategies, at the individual level and what's best for the family.
And Ms. Cash says she has a very quick additional
Quick.
comment.
Because I have this pressure on the health department. So if they see a cluster in one of our schools, what is their reaction on what they do to find out what's going on in that community?
I think I might actually kick that question to Kelly. Kelly, if you're still on, can you share what the process would look like if the public health department saw a cluster?
Good afternoon. If they see an increase in a certain area, they would contact us, Ms. Cash, to let us know. But as they're looking at cases, it's hard, as Mr. Coe said, to determine it's a school cluster. It's community-based, a lot of this. And again, it's really hard to determine there is a cluster in a school when there are swim teams and soccer teams and social gatherings where these staff and children are in. If they see a spike that they feel like we should be made aware of, they will contact Health and Crisis Prevention Services.
So it's actually the other way. It's the fact that we are an identifier of a cluster that is likely happening in the community. I want to know from the health department, what is their action in the community to investigate that and stop that?
Ms. Cash, that might be happening at the individual level as cases reporting might be happening. You know, that's a good question.
I would love to hear from the health department about that, the
Yes, ma'am.
Wake County Health Department,
Right.
and what they do in the community.
I think that's a very appropriate question for follow-up because it tracks along with the state not really defining or tracking clusters in any settings anymore. And so I think that's an important distinction in terms of if we are capturing data, then what is the county health department's reaction, support, whatever it might be, to us providing them that data?
Because we're required to report all communicable disease by state law. I mean, so.
Dr. Martin, quickly.
To respond to this exact point, we actually have unique data. I just looked up, for example, a high school and a middle school on the same campus. That should be as close to equal community, yeah? Right. The high school has a period of time through 5 weeks with 12, 19, 37, 26, 11 cases. During that exact same time at the middle school, the highest was 8. So that is pretty stark evidence, right? It's drawing from the same community.
So
No, you can look at elementary schools that are across the street from each other. We've got that data. We've got that data. There is some, I'm not saying it's all, absolutely not saying it's all, but you can look at this data, and if it were a community, then you'd see these kind of bubbles in almost all of our schools.
Well, then that's the health department's job, not ours, to Ms. Cash's point.
It is both because we have to deal with absences of employees and
Yeah,
students.
but I want the health department to take a full responsibility for this.
So
Not
we
part of
are-
the responsibility, not full. I'll take part.
So we heard from Mr. Coe and the superintendent that we are going to be closely partnering with the health department on this. And certainly this discussion reflects a broad range of feelings within the community. I want to thank Mr. Coe for being here. I also want to note that as a parent, I received an email from Wake County back in June talking about that shift in the community from low to medium level, reminding families about ways that you can mitigate the spread of COVID-19. And I hope that we will continue to communicate with our families best practices, and I hope our families will reach out to their healthcare providers should they have any individual questions, and their principals should they have individual questions as well. Ms. Waters, did you have your hand up?
Yes, just because there have been so many concerns brought up about children with special needs, in future updates, would it be beneficial to include Ms. McKenna in the conversation so that she can give us the perspective from her office so that we can better understand how things are going through that IEP process that we can see how things are going at the school level, because as we're telling parents to reach out to the school level and we have issues perhaps with the bottlenecks, I think maybe it would be useful, at least for me in understanding, to hear from Ms. McKenna as well.
Yes, ma'am. I'm sure we can make that happen.
All right. We have just about 30 minutes left in our work session. I know that the next discussion will also be robust, so thank you, Mr. Coe. We're going to welcome Mr. Cook and Ms. Acomey, and please let me know if I'm pronouncing that correctly. Acomey. Okay, I'm sorry, to talk about remote instruction days, which is another greatest hit in our school system.
An oldie but a goodie. With that introduction, Ms. Mahaffey, good afternoon, everyone. It is nice to be back in front of you today. Chair Mahaffey, Superintendent Moore, board members. We appreciate the opportunity to be with you this afternoon, as we've referenced, to provide an update around two new pieces of legislation that were signed into law in the recent weeks that have both immediate and future implications on the use of remote instruction in the Wake County Public School System. My presentation today and discussion will focus more on the immediate, though we will be following up further in the weeks and months ahead on the longer-term implications and future decision points as well. So just a quick overview. We'll begin with a high-level summary of both SB 671 and House Bill 103, which is the budget bill, and their impact on remote instruction. We'll discuss areas the new legislation addresses and its impact on the district planning for the 23-24 school year and beyond. And again, given the time sensitivity and the need for some important decisions in the short term, our intent is that the majority of our remaining time in conversation today will focus on the potential use of remote emergency instruction for the current 22-23 school year. We'll then close with a review of some of the important next steps that we'll share with you around implementation, potential implementation of remote instruction days, while also, of course, engaging in discussing and getting your feedback and input moving forward, which really is the primary focus today, in addition to sharing information, is just to hear your guidance and thoughts before we kind of codify into explicit guidance around what direction we may go as a district. As you may recall, when we last discussed the subject of virtual and remote instruction with you back in March of this year, much of our focus for that meeting and the previous year centered around SB 654, and we're throwing around lots of legislation here, which at that time established requirements around the ability of districts to provide remote learning as the primary means of instruction. Since that discussion in March, there have been two additional pieces of legislation that we've referenced, passed into law in July, that have short and long-term implications. These bills are 671, which speaks to remote academies, and also H103 as well. According to these new pieces of legislation, a remote academy is defined as a public school whose instruction is provided primarily online through a combination of synchronous and asynchronous instruction delivered to students in a remote location outside of the school facility. A remote academy may include any combination of grade levels. Beginning in the 2023-2024 school year, school districts wanting to operate a remote academy must apply to do so through the Department of Public Instruction. If the application is approved by the State Board of Education, districts will be granted the ability to operate a remote academy for a 5-year time period and may satisfy the minimum required number of instructional days or hours for the school calendar through remote instruction. Upon approval, each remote academy will receive a separate school code. A local Board of Education may apply for renewal of approval as a remote academy for additional terms of 5 years, at which time the State Board will determine the success of the district's remote academy in the prior 5 years to decide whether to approve a request for renewal. Finally, the most immediate implication that H103 and SB 671 present, and our primary focus again for the time we have today, is the provision allowing public school units the ability to again provide remote instruction in emergency situations for the 2022-2023 school year. Our intent here is to provide a review and an overview of the legislative parameters for the use of emergency remote instruction days, as well as our district's initial recommended guidelines for when, how, and under what circumstances we could choose to use these 5 days. choose to use these 5 days. So here on slide 4, you see a general overview of those legislative parameters. In alignment with GS 115C-84.3 and also our own local board policy 3102 on online instruction, when warranted by an emergency situation, including severe weather conditions, energy shortages, power failures, and other emergency situations, the superintendent may temporarily direct schools to conduct instruction remotely. As an example, other emergency situations, quote unquote, could include, but is not limited to, a temporary severe staffing shortage that makes it impossible to operate in-person learning, or that threatens the health and safety of students, employees, or the community. In the event that the superintendent directs schools to conduct classes remotely, the Board of Education would, of course, be notified of the decision and supporting rationale, as well as employees, students, and families. To the extent practicable, affected employees, students, and families will be notified of the change in advance of the remote instruction day. It is important to note that all board policies would remain in effect during any period of emergency remote instruction per the legislation. So with that overview of the general legislative parameters districts may work within, I'll turn it over to Lauren Acom to discuss the initial recommendations and language regarding when and how the Wake County Public School System could choose to use these processes and other procedures, expectations, and also look at next steps that we plan to engage in before finalizing any guidance that we would communicate out to schools and the community. Lauren?
Thank you, Mr. Cook. Good afternoon, Chair Mahaffey, Superintendent Moore, and members of the board. We are well aware that there are many opinions and feelings, both in support of and opposition to the potential use of remote instruction days in the event of emergency situations. However, with this recent legislation that once again does provide districts the opportunity to conduct 5 instructional days remotely, we do believe that the use of a remote instruction day might eliminate the need for a Saturday makeup school day, as well as protect our staff and students' scheduled vacation time and holidays in the event that some sort of emergency situation arises this year. Additionally, the use of an emergency remote instruction day might increase the likelihood of ending school as scheduled, as opposed to having to extend the school year to make up for any inclement weather days this year. In response to stakeholder feedback, district staff recommends that we utilize emergency remote instruction days after we have exhausted all banked days and makeup days as outlined on the 22-23 school calendars. We know that calendar changes present significant challenges for our families, our staff, and our students, and it is our desire to avoid making such changes if at all possible. So, for example, we would use an emergency remote instruction day prior to changing spring break or any holidays to meet the legal requirements in accordance with the North Carolina calendar law. It's the district's desire that we will announce the possibility of a remote instruction day in advance to ensure that students, staff, and parents have the opportunity to prepare accordingly. When making the decision, the impact of power outages will be considered to ensure that students and staff can access teaching and learning. We are keenly aware that we are embarking on protected territory when it comes to inclement weather days in the South, and it's not our desire to take away from the joy or the memories that many students and families experience during a snow day. However, we feel that a remote instruction day can provide the much-needed flexibility to mitigate the impact that missing multiple school days due to an emergency situation, including that of inclement weather, can have on teaching and learning. In the event of an emergency remote instruction day, the district has drafted guidance around the protocols and structures, teaching and learning, and the necessary preparation and communication in order to provide support and consistency for all staff, students, and families. During a remote instruction day, teachers will be expected to create, communicate, and post daily classwork in their learning management system for students to complete by the assigned due date. In the event of an emergency, the expectation will not include live instruction during the day to ensure equity and access for our students and staff. In order for students to successfully access their classwork, schools will ensure that all students in pre-K through 12th grade take their WCPSS issue device home in the event of inclement weather and/or prior to remote instruction day. Our colleagues in Digital Learning and Libraries has created relevant resources for asynchronous instruction that includes technology guides for parents and students, learning management system support, technology tools for all learning, and much more. Additionally, Student Support Services has provided guidance around behavioral health instructional practices in online instruction, as well as providing due process to students in a remote learning setting that will be reviewed and implemented by all staff in the event of an emergency remote instruction day. In accordance with Board Policy 4400 attendance, students will be counted present during remote instruction days if either they complete their daily assignments, whether online or offline, or they have a daily check-in or two-way communication with a teacher. A student's failure to log into a particular online program or lesson on a given remote instruction day shall not be grounds to mark the student absent for the day, as long as the student meets one of the other attendance requirements just described. Additionally, a teacher may change a student's attendance status from absent to present based on evidence that the student submitted assignments on a later date. We understand that many parents must work outside the home when school is canceled due to inclement weather or other emergency situations. The structures created for an emergency remote instruction day provide students and families with the flexibility as to when they complete their schoolwork throughout the day. As we began drafting district guidance around the processes and expectations of an emergency remote instruction day last spring, we collected feedback from the Superintendent's Student Advisory Council, as well as teacher and principal focus groups to help draft the district protocols, structures, and expectations around these days. After hearing your feedback and questions today, we are committed to continuing to engage our stakeholders, which will include a parent focus group, to seek input and feedback around what additional items need to be communicated from the district and/or schools in the event of an emergency remote instruction day. Additionally, we have been in communication with our attorneys at Tharrington Smith to ensure that our policies and procedures align to the parameters of SB 671 and H103. We will continue to review board policy, specifically 3102, online instruction, and 3300, school calendar and time for learning, to determine what, if any, revisions need to be made. We will bring that information back to the policy committee as needed. Finally, as our planning evolves, we will continue to provide updates and information to you, the board, as well as to our schools, families, and the community. We will continue to collaborate with central service departments and school staff to ensure that protocols, structures, and expectations around emergency remote instruction days are properly implemented and communicated to all stakeholders. At this time, we are happy to respond to your questions and listen to any thoughts that you might have around emergency remote instruction days.
Thank you so much. Are there questions as we move forward? Ms. Scott?
Thank you. While I greatly appreciate the efforts of staff to get to start to build, policy around this new these new bills that were signed, I can't help but think of the large percentage of our students that just don't have access to internet. I mean, our state has not passed or addressed broadband internet for everyone. And it is a huge concern. At any given time, we have several thousand students who are identified as McKinney-Vento who don't have a consistent place to sleep at night, let alone be able to access internet in case of an emergency. And I think until or unless the state can accompany bills like these to allow school districts to do this, they also need to find out and provide how many students need access to internet if this were to be implemented. I greatly worry about that. And even, I believe, with the hotspots that we were able to provide immediately from the pandemic, which again, I applaud the efforts of the school district of getting devices into the hands of children and getting the hotspots for those who needed them. But there are still parts of our county, though, where those really don't work that well. You can't use the video part, or you can't, I mean, it's spotty. So that's a huge concern of mine. And I recognize, I'm really speaking to my district and parts of Monica's from a geographical perspective. But it's just a huge concern of mine is putting in a policy in place like this and then seeing the students who need the most help just fall further behind when their peers who have access are able to maintain and excel.
Thank you, Ms. Scott. And I think we can acknowledge tremendous progress, obviously, in terms of accessibility and access to the internet and opportunity. But I think to acknowledge your point, that's a potential drawback. And I think, that's just to be clear, this is an option. It's not a requirement that the district implement, and I think that's also what you just shared goes into the broader rationale as to why, if we did implement these days in Wake County, our recommendation would be do it almost as a last resort after we have exhausted, I'm looking at the traditional calendar as an example, all of our bank days, January 27th, February the 20th, and then we would be looking at adding a Saturday or adding a day during spring break or adding a day on to the end of the school year in June to meet instructional requirements. So absolutely there's drawbacks, but I think that's part of the rationale that we acknowledge anyway in terms of why we would not do as some districts have done and may choose to do again, in just the first snow day, call it a remote instruction day. That is not our recommendation. For all the issues related to accessibility, and I think going back to the boards and the district's focus on getting students back for in-person instruction every opportunity we possibly can. So I think we acknowledge that, and that's part of the rationale for why, if we chose to use this, our recommendation would be to do it on the back end when other options have been exhausted in terms of the calendar.
Thank you, Mr. Cook. Ms. Carter?
And thank you for that. I do appreciate that it's what you're saying about the very last. But for me, that's why I voted against the 4,400 policy, because it had it right in there every time, because I still feel like I hear of missing multiple days due to an emergency, but having multiple or even one remote instruction day can have a significant impact on a student, especially hearing, no live learning, and then with students who would not be able to even access it anyway if there was live learning is a concern. And just as one board member, I prefer not even having, I know it's an opportunity that we've been given, but sometimes it's better to pass on an opportunity if it's not best for all of our students. And I feel like there's a lot of students, this would not be in their best interest, even if it's just one day or 2 days, especially if it's 2. And I hear in advance, the wording that you use there, but my concern with that is what's considered in advance, the morning of at 5 a.m., the day before, because of, let's say a surprise. I go back to, it was many years ago, but where we were supposed to get a couple inches of snow, we woke up with like 24. No one was prepared for it, same thing. So that's to say they had nothing. Even for the students who typically would have access or could have access, I just worry there's a lot of moving parts, and looking out to have the most in-person instruction possible outweighs this opportunity in my opinion. Thank you.
Ms.
Yes.
Cash?
Well, I think Ms. Carter said it well, and I've not been a fan of remote instruction, as I've been clear, and makeup days, I kind of wish we were in the olden days where we didn't have all that remote possibility and we had to go to school on Saturday. But I'm not a teacher and I'm not a parent right now. But when I look at slide 7 and I read through it, it's like I see nothing on there that an elementary student that doesn't have a parent at home being able to achieve. If they have parents at home, possibly they could communicate. These are mainly complete classwork, assign, have the ability to email. All these things are not elementary driven. So again, the elementary school kids are, especially those that go to either a daycare when their parents are both working or don't have parents at home and are home with siblings, I don't see that they can access any of this. So, and I would not want them to have a remote instruction day, but that's my opinion.
Thank you, Ms. Cash. And speaking of our elementary kids, as a parent who dealt with 3 elementary kids on remote learning days, this brought up a question in my mind. And when we look at our banked hours, our elementary schools usually have more than our middle and high schools because of class changes and what have you. So have we looked as a district, whether it's remote learning days where there's an asynchronous day, or whether it's just Saturday school or cutting into a vacation, differentiating our banked hours so it's not the full K-12 district, but our elementary students who have more banked days would not be subject to, if we go forward with a remote learning day or a Saturday school, based on the banked hours at the elementary, middle, or high school level that are available. And maybe the superintendent wants to speak to that one. I don't know.
I'll just say we've had that discussion, that there are different number of banked hours available by level. Elementary do have more. We've set the sort of baseline at 3 because high schools have class changes where you can't count those minutes in between, and elementaries do not. And so so that is a possibility. Certainly, that is a possibility that we could assign more remote days, more banked hours to elementary schools, and have the opportunity to carry those banked hours for more days, and the makeup would. But I think this is what you have to figure out, though, is do they make it up? Or do we use banked hours? Banked hours require no makeup, so they're not there for in-person learning, whereas for a middle or a high school where you're more likely to be able to potentially have access to the structures to engage in remote learning, wouldn't have to make it up because they're engaged in remote learning. So you've got different, you're unleveling the playing field a little bit in terms of what you're prioritizing with regards to the ability to access what might be done on a remote learning day versus having to make up the time at all and be in person for those hours.
Mr. Haggerty.
Okay, so I'm going to go in a different direction with this. You know, every time we have a snow day and it doesn't snow, we hear from all the parents about, why are you canceling our vacation? Why are you doing this? Now we're going to have to go back to school on a Saturday. And I've had the same thing proposed to me by so many parents about why couldn't we use remote days. But I hear all of the concerns that you're raising. So I have a question for you. If you have a remote day, I think we've been thinking of the remote instruction days on the same day as the missed day, right? So if you had snow or if you had something where the parents would be at work, you're putting the burden on those families when the parents aren't there. But if you had a remote day, an asynchronous day on a Saturday as an alternative to having the kids go to school on a Saturday, which we have to do, and this is a real problem in a lot of our year-round schools, right? Because of their calendars. When they run out of bank days, we have to put them on a bus on a Saturday and bring the teachers and the parents and the kids in on a Saturday. Couldn't we do something where we have a remote instruction day that doesn't rely on technology, but we just give them the assignments in class, in paper, to take home on Friday, and they could do that remotely, asynchronous, at home with their parents without having digital divide issues. And that way you wouldn't have to open up the schools again on a Saturday. It may not work. I'm just throwing it out there as an option to avoid the Saturday school.
No, I mean, I think it's creative, and I would maybe. I don't see anything in the legislation, although I'll defer to Mr. Blumberg, as to whether or not it has to be, as we're discussing in this context, remote and virtual and technology-based, as opposed to remote but non-technology based and planned on a date, not necessarily on the day of the event or the emergency that it occurs.
I just think it's a great question and worth exploring a little bit further. I mean, what it says is basically that school systems can use up to 5 remote days or 30 remote instruction hours when schools are unable to open due to severe weather conditions and so on and so forth, emergency. So that's the way it reads right now.
Okay. Dr. Martin.
So I think this discussion is important, and I concur with Mr. Hegarty. Right? Every time we have to tap into spring break or extend school, we get exactly this, why didn't you? And I mean, I think to respond to some of the earlier questions, should we put it in policy, should we not put it in policy? I mean, I think this is one of those things that it would be unwise not to give ourselves the option. That doesn't mean that we're going to choose to implement all the time, but you know, what are the scenarios that are going to come down the pike? We don't know. And so if we take something off the table today, then we run into a scenario where it would have been useful. All we've done is hurt ourselves. We don't have to use it just because we're allowed to use it. And so I think it would be wise for us to craft a policy. I think it'd be wise to us to craft some guidance around how we would do it. Creative options like you've suggested, I think, you know, rather than the Saturday school, why not? But I think to not have the option available would be very unwise.
So just in terms of where your policy is right now, your policy currently allows it. It allows the superintendent, you know, to switch to remote and so on and so forth. What the policy needs to be revised, though, to reflect the current law that says up to only 5 days or 30 hours can be used towards the instructional calendar satisfaction. So there would need to be a policy change there. One other point that I want to make as you decide whether you want to continue to have this as a last resort option or not is that the law did allow last school year, the superintendent and the board allowed this, went for COVID reasons to close individual classes, schools, and what have you for COVID. That law's gone. Okay, that no longer exists. What does exist is these 5 days and 30 hours. So this would be, if there were a situation where the superintendent needed to, for a particular school, to do that, this would be a scenario that it's an emergency, you could use this time. So as you look about whether you want to leave it as a last resort or not, that's something that I just think you need to be mindful of.
So it sounds like we have some questions and some firm beliefs as we move forward. And yeah, Ms. Scott.
I just had a really quick follow-up.
Go ahead.
Is it possible to survey families as to whether or not they have reliable internet access at home, just to be able to capture that in an informal way, like with, well, I'm not saying that necessarily email, but is there a way to capture that? I would just be curious to know that, and it would, I don't know if that's possible.
I think it's possible. I think the best way to gather that information really is at the classroom level through communication with either students who are old enough to understand what you're asking or a Monday folder or something along those lines, because when you do it from a district, you immediately excise a group that's not going to capture that. So we can certainly talk about that moving forward. But that would likely be the way we would try to operationalize something like that.
Ms. Kushner.
Thank you. And my other suggestion is we look at attendance data from makeup days, including that year that shall not be named when we had to impact spring break. Because I do think the attendance was, if I recall, was stronger at the elementary level than the high school level.
I believe it was.
But I think it's important to look at that data. Yeah.
I think it was 3 days from spring break that we had to capture because I subbed in French class.
That until I blocked that from my mind till this discussion. So yeah.
So we have some questions moving forward, and it sounds like, based on what we heard from Mr. Blumberg, Ms. Kushner, we may see this back in policy committee for more discussion moving forward. So thank you very much, and that is the end of our work session.
Thank you.
It is currently 5:30. We'll take about 10 minutes so we can set up, 10 to 15 minutes so we can set up for our board meeting, which we will be starting a little bit later for that reason, as it's 5:31 now. So thank you.
When are you going to be sending the